Can you talk about some of the more common conditions that you address, or even some of the uncommon ones, like the ones that people don't know about or don't think is a neurological condition that you guys tackle on your platform?
We do things that are incredibly common. Concussion,
Mhm.
words like traumatic brain injury are very scary, but we hear things like concussion all the time. And so what does that look like in real life? And how is that relatable? We see it every day, right? You see it with your football players. What does that look like on the science side?
Yeah.
And how can we make that relatable? And so that's something we certainly addressed and talked
Mhm.
about. A few months ago, I did a topic on something called normal pressure hydrocephalus, which is actually very, very common,
Mhm.
mostly in our elderly population. But the unfortunate thing is that the most common symptoms with that are patients are wet, wobbly, and weak, and so or wacky, and so they're a little bit confused. And so if you're older, sometimes people say, oh, grandma just is confused, and
Yeah.
she's
Yeah.
tired or whatever, and they have some urinary incontinence, and they're like, oh, that just happens with grandpa's
It's
prostate.
literal. Yeah.
And so, but this is an actual condition that we can make huge improvements on patients' lives if they know it exists. If you don't feel like you can leave your house because you might have an accident or you might
Yeah.
fall, those are the things that we want to highlight, that these are common, and
Mm.
let's talk about it. One thing with the brain is people classically feel like brain surgery is end of the world. We had brain surgery and you never came back from it. When
Right.
the brain touches the air, it's bad,
Right.
right? But that's not the case. People will go home literally the next day and have a completely different outcome, quality of life.